personal behavior transmits HIV. Personal behavior can also prevent the transmission of HIV.
Okay, the first one, the first bullet, about 30 years. In fact, the early 80s, before all of you all were born, is when we first began to hear of HIV/AIDS. When I was your age, there was no such thing as HIV. When I was your age,
what about
there was
swine
no such
flu?
thing as HIV in the world, which is why we were saying last week, I think we got into a little discussion about Tuskegee study and how the government was behind certain things. This is why some people might speculate, and I use that word in parentheses, that they don't know where HIV came from, because when us older persons were your age, there was no such thing as HIV. There was syphilis, there was gonorrhea, there was maybe crabs, but HIV, no such thing. And so people quite naturally would ask themselves, where did it come from? Where did it come from? And of course, it began to affect white gay males initially, but it began to move on. In most cases, just as personal behavior transmits HIV, personal behavior can also prevent. And so what we mean by that is that it's in your hands, Brendan. The fact that your behavior can create the transmission of HIV to yourself, just like your behavior can prevent you from catching it. Some diseases, some conditions are hereditary. Sickle cell, high blood pressure, diabetes. Some things run in your family. If your great-granddaddy had diabetes, if your granddaddy had diabetes, if your daddy had diabetes, guess what? You have a very high chance, you're a very high risk of contracting diabetes. Except in the case of an infant